unmuted.
So he's gonna be traveling a little bit?
He doesn't have to move though.
Well, that's good.
Okay, I would like to call the Health Services Committee meeting to order, please, for May the 23rd, 2022. And the first thing that we need to do is approve the minutes of last month's meeting. Barachi, second by Supervisor Conover. Any additions, corrections to the minutes? All right, if not, we'll vote then. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. And Rob, I'm assuming you're on Zoom? No? Oh, great. I was looking up there.
God's zooming in.
Recognize you, Rob.
He's zooming in from 5 feet
I wasn't
away.
looking over there.
Using the podium now?
Yeah, that would be fine, yes.
Okay, good morning, everyone.
Good morning.
The only new business item I had was a resolution request to amend the 2022 Warren County budget in the amount of $195,655 in accordance with an attached Schedule A to accept 100% state aid funds. This is part of the 2022-23 New York State enacted budget. Primarily 5.4% cost of living adjustment, COLA funds, and also includes some supportive housing funds. The attached table shows the contract agencies that we have that are receiving these funds and a breakdown of the amounts totaling $195,655.
Thank you for that information. Mr. Conover would like to make a motion to bring that resolution to the floor. Is there a second to that? Supervisor Beatty, any discussion? Right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Right, just one other item, informational. It wasn't on the agenda, but if I could, would like to thank the board for issuing the proclamation for May as Mental Health Awareness Month. Tune into the previous conversation, heard most of that, and even had it on my cell phone as I was driving up here. So I heard most of the conversation this morning. Important conversation. We know that 1 in 5 Americans live with a mental health condition, and that 1 in every 20 Americans is living with a serious mental health condition like schizophrenia, bipolar disorder, or major depression. 50% of all lifetime mental illness begins by age 14 and 75% by age 24. We know that not all of us have a diagnosable mental illness, but we all have mental health, right? If you think about mental health on a continuum of wellness, just like physical health. So it's important to tend to those things, take care of ourselves, and take care of others in our community. I don't know if anybody had any questions for me from that conversation this morning.
Supervisor Graber.
I do. Thank you, Chairwoman. I'm glad you were able to hear most of that because I kept thinking, I wish Rob were here.
Yeah,
It was great to have the sheriff coordinating there. I just want to make sure that you're in the loop as well. There was the question about whether or not the ARPA funding that we just passed on Friday can be used for expanding the mobile crisis unit to 24/7. Given the concern from my colleague from Stony Creek that, you know, maybe we can't use ARPA because this is going to be an ongoing expense. But we did hear from that one organization that they just needed help with the startup costs, that we could use ARPA money for that, and then they'd be self-sustaining. Can you speak to whether or not any of that million can help them with startup cost type things, or where we are? Or do you think we need a whole nother allocation for that 24/7 in conjunction with the other counties that also use Northern River for that mobile crisis response team?
I mean, I think that it's apparent that due to COVID, you know, that there has been an increase in demand for the services. I think it fits within the ARPA. It's a little bit tricky because, as you heard, they're a regional service and the state funds them to respond regionally, right? The funding for a tri-county children's program flows through Warren County. So our contract with them is actually for children's response for Warren, Washington, Saratoga County. The adult response for the region runs through a contract that Rensselaer County has with them for Warren, Washington, Saratoga, Rensselaer, and Schenectady. So I think as Jennifer pointed out this morning, it's a little bit hard if we were to allocate ARPA funds to them to increase overnight coverage or off-hour coverage. You know, they might be able to staff up, but those staff are going to have to respond wherever there's a call. So I don't know how people feel about that. That's why the state aid, you know, it works out. But once each county starts adding funding in, unless counties were to come together, you know, and fund it jointly.
Is there a way to crisply define the question at hand? Don't we want a response from someone in responsibility to answer Frank's question, you know, so that there's no ifs, ands, or buts about it. Yes, we can use the funds, or no, we can't. And then going forward, we'll be in a reasonable position. So my question is, how do we get that answer?
I thought we had the answer.
Mr. Beatty?
Yeah, I thought, correct me if I'm wrong, that we had the answer that we could. That's my perception from the ARPA meetings, that we could use ARPA money. But now I'm hearing differently.
Supervisor.
I
Baylor?
think the question is not that can we or can't we? I think we could, we're authorized to. I think that the bigger concern though is, okay, we have ARPA money to get them going for a year or two, maybe 3, or through 2026, whatever. But then what happens after that? Where are we going to get the money paid for it after that?
And correct me if I'm wrong, but I thought they said that they would have the funding in place, right? To keep going after that.
Yeah, that's the Medicaid
Right.
billable.
Right. So that's how I interpreted that conversation, that the money would be in place. They'd have the money in place to keep it rolling. We'd help them get the ball going. Am I
I
wrong
just
or
want to
right
be
on that?
clear that that's true.
Well, okay, okay, so how do we get that verified, whether it's accurate or not?
Mr. Moore, could I call on you? Would you help us with that question?
Yeah, these are allowable uses of the ARPA funds, but as Supervisor Bramer said, the question is, should we? How does this fit into the $1 million that we've allocated to the Community Services Board? Are there other more important priorities, or is this something that we want to work in? And I think to the extent possible, we should be using ARPA funds for one-time expenses or things that we can get up and running that will be self-sustaining. So that's my take on it.
Any other questions? Supervisor McGowan?
Thank you, Chairman. Is there a possibility that maybe we could reach out to the other counties and see what we could do to, everybody puts a little bit of their ARPA money, you know, toward this program to get it going? If that's the direction, or if the other counties don't want to do that, if we, as a group, because as it sounded like earlier and Rob just said, it involves, you never know where all the employees are going to be going. It's a multi-county thing. So should we be reaching out for there? Is there grants that we can help them with too, or right? So many questions.
Rob, do you have any ideas on that question?
Well, I mean, I can reach out to my counterparts and have them, try to push this up through their committees and through their, county admin.
All right, thank you. Any other questions? Mr.
Yeah,
Durante?
just one, we would need a proposal, I assume, from Northern Rivers about what the cost would be first, right? So do you want to ask them that to give you a proposal, and then you can take that forward?
Yeah, they're part of all of our contract agencies will be part of a process with that carve out that was designated for the Community Services Board. So yeah, they would be submitting proposal along with, other
Okay.
agencies. Yeah.
Any other questions? All right, thank you very much, Rob. We appreciate your
Thank you.
being here. See you next month. Tell where D is. I can't tell.
D is on.
Okay, D, good morning. We're all set.
Good morning. Can you hear me okay?
Yes, we can.
Okay. So the first item on our agenda is permission to fill the meal site manager number 2 position in Warrensburg at a grade of 2, 30 hours a week, $14.29 an hour, and then to backfill any positions that may be vacated due to filling this one.
Would someone like to bring that motion to the floor? Supervisor Conover, second by Supervisor Durachi. Any questions on that? She did say that the person in this position resigned and the position is needed to ensure we're able to provide meals to residents of the Warrensburg, Chestertown, and surrounding areas. All right, all those in favor? Aye. Opposed? Carried. Thank you. Number 2.
The next item is permission to amend resolutions 208 of 2019 and 121 of 2019 to remove Glens Falls Hospital Medical Alert and replace it with Connect America. Basically, Glens Falls Hospital has been, or was the one that was giving us our PERS, the Personal Emergency Response Services, and it switched over to Connect America back in 2020. And then this will just give us permission to continue with that with 1-year renewals as long as the amounts remain the same.
All right, would someone like to bring that motion to the floor? Supervisor Conover, second by Supervisor McDevitt. Any questions for D on that one? All right, then we'll vote on it. All those in favor? Aye. Opposed? Carried. Thank you.
Item number 3 is permission to extend our contract with Pure Food, Mom's Meals for an additional year from September 1st through August 31st. And this is basically to provide the meals in emergency services if we're not able to. Currently, they're providing it for our Lake George route and then 2 individuals in Lake Luzerne.
All right, someone like to make that motion? Supervisor Conover, seconded by Supervisor McDevitt. Any discussion?
Was it, excuse me,
Yes, Mr. Gerard.
was there a question about the quality of this food at one of the?
Dee, would you like to answer that question? Mr. Geraci says, was there a question about the quality of the food for Mom's Meals?
We've been doing satisfaction surveys for this since it started last year, and there have been some people that have liked it, some that haven't, but it's kind of it's the same as with our meals. There's some that like it and some that don't. Overall, the ones that are getting it do like it. The 2 individuals in Lake Luzerne specifically requested it, so that's why they're getting it. And as far as the Lake George people, as soon as we can find volunteers to deliver the meals to them, we will be switching back to the meals out of the Warrensburg meal site. We currently have a driver that's willing to do it on Mondays and Wednesdays, but we still need somebody for Fridays. That's why we're still using Mom's Meals for that route.
All right, thank you. I thought there was some discussion about this at a board meeting some time ago. Thank you.
I think way back there was some discussion, but I think things have changed a little bit over the course of time. So I think that's where we stand at this point. Did we vote on that? All right, we need to vote on that. All those in favor? Aye. Opposed? Carried. Thank you. We'll go on to the discussion, or is there something for 4D?
No, there was nothing for item number 4.
Okay, so we'll go on to discussion items then.
Okay. So discussion items A and B, the ACU is having its annual conference from June 7th through 8th. So we asked permission for myself and for Roseanne to attend the conference in person, and then for 4 of the staff members to attend it virtually so they can do it here in the office. And with the individuals that are attending it in the office, it's actually going to be anybody in the office that wants to attend it can, but it was easier to do 4 individuals for both days and cheaper that way, and then they can split up who wants to attend it.
All right, good idea.
And then the next discussion item was our annual report for 2021. This should be a second attachment that you guys had. You guys were given a color copy by, I believe, the Board of Supervisors, or the clerk gave you the color copy for this. So I'll just give you a quick snapshot of it. Pages 2, 3, and 4, it gives you a breakdown of the different programs and the funding through the New York State Office for the Aging. Page 2 lists the federal programs. Page 3 lists the state programs. And then page 4 goes over the stimulus monies that we received. More specifically, underneath each program, it lists the different services that we could offer underneath that actual funding stream, the amount of funding that we got last year from NYSOFA, and then the NYSOFA match, which is listed in the top right-hand corner underneath each funding or each program. So you'll see, like for Title 3B Supportive Services Program, it says that it's 90% federally funded, and the maximum that we got last year was $64,451. So that's kind of just a breakdown of that. On pages, or the last page of section 4, or last page of page 4, goes over what stimulus monies we actually used in 2021, so that you have an idea of what we used. On pages 5, 6, and 7, it goes over what services we actually offer here in our office for the aging. On pages 8, 9, 10, and 11, it gives you a review of the different services that we contract out for using these funding programs. And it gives you a little synopsis of how much we gave to each provider for the last year, as well as the units provided, and then the number of clients served. Pages 11 and 12, starting at the bottom of 11, gives a review of what we did in the office ourselves last year. A couple of things that I'd wanted to note was that the main focus of 2021 in the beginning was getting our seniors vaccinated, which was a huge undertaking, which you can see in there, and then making sure that we continue to provide meals to our seniors. 2021 was another year of collaboration with our fellow county departments and various community partners, so I wanted to emphasize that. And then it was also a difficult year for our staff here in the Office for the Aging with the uncertainty of the future, in particular with the meal sites. And I'm very grateful for the amazing individuals that we have working in this department. Pages 13 through 18 will then give you a breakdown of each of the meal site statistics since 2016. And then the last pages includes our fiscal review for 2021. As noted in the report, for 2020 and 2021, these were unprecedented years when it came to the county portion of expenses. During the major disaster declaration, we were given great flexibility from NYSOFA with our spending. Basically, we were allowed to use any federal or any funding that we received for any expense. And then we also received large amounts of stimulus monies. So with that being said, you'll see that our county share for both Hamilton County and Warren County was considerably less than it normally is. So for 2019 is what you would normally see. In 2020 and 2021, it was considerably less. I do expect for 2022, it should probably be about the same because we still have stimulus monies to use. But for 2023, I expect that we'll go back to normal. So overall, I hope that this report is helpful for the supervisors. If there's anything that you would like to see in the report that is not in there, please let me know. We'd be happy to add it. But in review, I'm truly grateful for the work that is done by the team here at the Office for the Aging. And without them, we would not be able to have, you know, the great work that we provide to our seniors and everything that we've been able to accomplish the past year.
Thank you, Dave. That was very nice of you. And that's a good annual report. And I hope all the members of the committee take a few minutes to read it over because there really is a lot of good information and you're aware of just how much our county does for our citizens. Thank you, Dave.
Chairwoman.
Did you want
Welcome.
to on 5? Oh, I'm sorry, Claudia.
That's okay. Just quickly, noting I can't see Dee, but I'm hearing from her report about the staff and what a great job they did. I really appreciate her mentioning all of the staff and seeing that several times in the report, but I'll go through it more carefully.
Right.
I do want to just mention, the meal site manager that came on for approval earlier is only $14.29 an hour. I thought that, at least restaurant minimum wage is $15 an hour, isn't it? Really like to see us be able to increase these salaries because I think it's going to be very hard for people to pick up a job when they can make more working at McDonald's.
I agree.
Can I make that a motion that we increase the meal site managers to $15 an hour?
Are they part of a bargaining unit?
Yes.
So we can't just say we're going to change it.
No, we'll run it through reallocation.
And when is that happening? Ryan, I tried to do this last year during CSEA negotiations.
There's 2 ways to do it. You can do it in the contract or you can do it through reallocation. And reallocation, we invited the union to start it in January. And we are doing our part now. With basically the union comes up with titles. We're waiting for those and we come up with titles. We typically do our side in May. We would have done it earlier if we had gotten those titles. So and these positions are in mind.
They are in the reallocation. Okay.
Glad to hear that. Yes. Mr.
Yeah,
Deputy.
I think Claudia brings up a very good point. What has happened in this country in the last year or two as it relates specifically to people making 13 and $12 an hour has changed dramatically. Okay, so we're into a new arena. Okay, so I think, Ryan, when you in the negotiating process, I think people are going to look at this with maybe a different perspective. Okay, so starting someone at $14 an hour just doesn't work anymore. That's the world we live in.
All right, any other committee member have anything they wish to comment on? All right, if not, thank you. Oh, I'm sorry, Mr. Bristol.
Thank you, Chairwoman. I just wanted to commend Dee for an outstanding report, easy to read and put into perspective. I also wanted to remind board members that Office for the Aging sent out a flyer last week promoting the need for volunteers for home delivered meals. It was a nice flyer. I've already forwarded it to a number of my community partners. The ideal scenario, in my opinion, is that we have actually a waiting list of individuals who are interested and able to provide that type of service in the event that they go on vacation, that they're not well. Having more people than we need is always a good thing. So I would encourage members to share that with constituents and members of the public that they interact with on a regular basis. Thank you.
Thank you, Supervisor Driscoll. Yes, indeed, again, thank you for an excellent annual report. We appreciate all the work that went into it.
Madam Chairwoman,
Yes, I'm sorry.
Yeah, sure.
it's Leggett, Supervisor Leggett.
Mr. Leggett, go ahead. I didn't see you.
Thank you. It is a good report. And just for clarification, on page 20, the county share went from 667,000 down to 162,000 because there was relief funding involved. Is that correct? And that relief funding will no longer be involved?
Still some.
Correct. We received quite a bit of stimulus monies that we were able to use last year. And with the stimulus monies, the majority of what we used last year did not have a county match requirement with it. And then we still have stimulus monies that we can use for this year that we held off on so that we could use this year and then carry over monies from 2020 and 2021 that we didn't have to use. Like it says in the report on page 4, we had Title 3C1 and 3C2 carryover monies that normally we would use. But because we had so much stimulus monies, we used that first, and then we carried that over, the stimulus or the Title 3C1 and Title 3C2 monies over into this year that we will hopefully use this year. So again, our county match will be significantly lower this year than it normally would be. So yes, because of the stimulus monies, our county portion was significantly lower this past year, and then because of the stimulus monies and the amount that we could carry over from previous years, our county match will be lower this year as well. But again, in 2023, I expect it will be back up to our normal county match.
Okay, thank you. And Madam Chairwoman, if I may, do a follow-up.
Go ahead.
Thank you. For the Title 3C1 congregate nutritional services and looking at your charts with the congregate meals there, are you going through a whole process about what to do about congregate meals? Whether they're still a viable option for communities, if they're, if there's still a demand for them, et cetera.
Yes, at this point, we don't intend on closing any congregate meals. They've not been open because of COVID and because of staffing issues. As soon as we get our staffing levels back up to par, we will be opening up all of the congregate meal sites 5 days a week. Currently, the majority of them are open 3 days a week, but we do have some that are not because of staffing levels. But again, once the staffing levels get back up to par, we will be opening up those meal sites that have been not open for congregate meals back up, and then the rest of them will be opening up to 5 days a week as well. And we're hoping to see the numbers back to where they were pre-COVID, but that will be dependent on the seniors, whether or not they feel comfortable coming out into the community. We hope that they will. We do anticipate having our congregate numbers back up where they were. We don't anticipate closing any sites permanently.
And is there a base level of congregate usage that would determine whether or not a congregate meal site would stay open or not? And I'm looking.
We don't have a base number.
With three people on average any particular day, that's a hard cost to justify.
At this time, I haven't heard any feedback about closing any congregate sites based on the number of attendees. That would be up to the supervisors and whether or not they wished us to, but we don't intend on closing any congregate sites permanently, regardless of the numbers. At the office, we don't intend to.
Okay, one more question, if I may. Because of lack of attendance at our congregate meals, didn't the state demote the Chestertown meal site on its staffing level?
That was not a decision made by the state. That was something that we did. We didn't close the site itself. What we did is we decided to consolidate where the meals were made. It made sense to have them produced at Warrensburg and then transported up to Chestertown.
Okay, thank you, Dee. Thank you, Madam Chair.
You're welcome, Supervisor Hogan.
Thank you. Wasn't that decision made pre-COVID for Chestertown?
Chestertown, yes.
Okay. I would hope that nobody's making decisions based on numbers as they reflect for the last 2 years. Right?
No, we have not been.
Thank you.
All right. Any other questions for Dee? All right, if not, then thank you very much, Dee. It was a wonderful report.
Thank you.
Good morning, Janelle. How are you?
Good morning, everybody. Happy Monday.
Thank you. Same to you.
Let me just go ahead and start.
Go right ahead. All yours.
Okay. Resolution request number 1 is to authorize extension of the New York State Women, Infants, and Children, which is our WIC grant, through September 30th, 2023, and authorize increased federal funding in the amount of $536,258 for a grant period of August 1st, 22 to September 30th of 2023, which does reflect a $10,515 increase in previous annual amounts. This is on attachment number 1. Health Services is currently a sponsor of our local WIC program. We have been for years and years and years, and it serves all eligible clients. This is a 1-year extension to a current grant that's already in process, and the WIC program is offered at no cost to the county as it's totally grant funded.
Would someone like to make that motion to authorize the extension? Supervisor Conover, seconded by Supervisor Bramer. Any discussion? Supervisor Bramer.
I have a quick question for Janelle on this one. Do you know if WIC has infant formula right now available to people?
The answer is no. We typically give them a NIWIC card and then they get formula at different locations. I did speak with our WIC coordinator this morning just to kind of get a brief update. If people have difficulty finding formula, they're encouraged to try all the stores. If they're unable to find them, and that's asking, do they have anything in the back room or this, that, and whatever, then it goes to the vendor management where they call our county. Our county will try to help them secure some formula. If they can't, we go to the WIC program, and then it's from there, they do like a special order. If they can't locate it at a certain store, if they can locate it and say, hey, there's a store in Albany, they're going to put this on hold for our client, then our client will go get it. Then they can't do that. Then it goes to like a special order that's dropped off at WIC, and then the client will come pick it up at WIC. But we don't traditionally store or have access to formula at our office. It's just in the event it's difficult to find and the special order situation happens, we'll receive one on behalf of a WIC client.
Okay.
All right, Supervisor Beatty.
Thank you, Madam Chairwoman. Janelle, so are we getting any help from the federal government on this issue? I know they put out a website, and obviously in the news, they're flying some in, but I mean, I guess my question is twofold. How much of a demand or how many questions or concerns are you receiving? And then the second part is, has the federal government been able to help out if you've requested help from them, or maybe you haven't, I don't know. So
in speaking with our WIC coordinator this morning, she's saying that they get probably 2 to 3 calls a day that they help people work through. And the process that she described to me, they've been able to assist those 2 to 3 people through the process that she described. So whether it be, helping them find a store that has it or doing the special order. And when they do the special order, we get it within 2 to 3 days.
okay, so you haven't needed the federal government to assist at this stage?
Well, I think the federal government is trying to kind of help all agencies because, the problem's not just Warren County. And certainly we want to see a quick resolution to this issue because we are feeling it locally. But, I think there's a lot of people in the same boat that we are. So there's not really a quick fix. My understanding is the plant that's been shut down due to some health and safety reasons is hopefully going to be getting approved to, start up again. I know that's a 6 to 8 week process before we start seeing, the formula on the shelves from what I understand. I do know that there's, moms helping moms where like when they find out where there might be formula, they're spreading that word to other people so that they can get them. Unfortunately, hoarding's not too good, but there are some people that, have been hoarding formula as well. But I do think for the demand that we are seeing personally through our WIC program, the 2 to 3 that we're able to kind of handhold through the process, we are able to kind of facilitate that. I did have discussion with our WIC coordinator this morning that perhaps we could use some family help funds to, maybe order some formula or find formula, if we're even able to locate any, to have a very, very small cache. So that if there is somebody that's incredibly desperate, totally out of formula, and they're waiting for the special order scenario to come through, that maybe we're able to give them a can of formula. But for right now, I guess the thought is we're just trying to help and educate and provide outreach the best we can.
Do you need funding from the board here to assist in you mentioned maybe creating a cache for emergency situations for mothers who can't find the formula? Do you need funding from us to go forward with that?
So WIC is federally funded, and we can't purchase the formula through the WIC program or get reimbursement for that. But we do have a family health program that has a supply line, Tom, and we haven't used that because of COVID. So, I mean, I do think we might have some funding in our budget. I mean, I wouldn't be looking to hoard too much, because then you're taking it from the local people trying to find formula. I was just looking to have, a couple cans of each, kind of for those dire and desperate situations. But I do think that we do have the funding already in our budget. I'm not sure if I need authorization from this committee or the board to use those funds, but I would imagine since the regular supply, I should be able to purchase what I need to help supplement the WIC program.
Sounds like to me you already got it handled.
Yeah.
Yeah.
I think so. Okay.
Yeah.
thank you.
Okay. Thank you.
All right, we'll vote on this now. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Resolution 2.
All right, this is to authorize a contract with New York State Rabies Program to receive grant funding for a period of 4/1/2020 to March 31st of 2025 in the amount of $51,759. The grant period is going to be divided into 3 different years that would go from April 1st to March 31st, with annual funding of $17,253. This is on your attachment 2, and New York State provides this annual funding to help offset the cost of the rabies program related expenses for outreach, vaccination clinics, and rabies post-exposure treatment. Sometimes it's not considered nearly enough, based on how many people we have to treat for rabies, but it does help offset the funds.
All right, thank you. Would someone like to bring that motion to the floor? Supervisor Bramer, seconded by Supervisor Geraci. Any questions? All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
More good news, more money. Resolution request number 3 is to authorize a contract with the New York State Health Research Institute to accept a New York State Public Health Emergency Preparedness funding in the amount of $52,099, not to exceed $1,052,999 for a grant period of July 1st, 2022 to June 30th of 2023. This is our regular emergency preparedness grant that we receive funding for every year. New York State provides this annual grant funding to assist with our required emergency preparedness staffing and activities. To note, this year we did have a $2,000 increase funding from our previous grant.
Make that motion.
All right, Mr. Beatty makes the motion. A second to the motion. Supervisor McDevitt, any questions? All right, if not, we'll vote then. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
For the 4th resolution request, it's to amend our 2022 budget to reflect the $2,000 increase in the New York State HRI Public Health Emergency Preparedness Grant for the period of July 1st, 2022 to June 30th of 2023. It's a follow-up of the resolution request that you just approved. Ton is here if you have any questions.
Move it.
All right, moved by Supervisor Beatty, a second to that. Supervisor Bramer, any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Okay, Janelle?
So we have all of our regular attachments for review. Ton is here to go over our report of revenue and our expense comparison report.
Attachment number 5 is our financials as of May 12th, to give you a comparison. Again, to bring to know all the revenues, we are working on finalizing our April billing for our home care. And our, down below where you see our salaries, you can see the big difference, how COVID has affected our salaries. That we are 18.79% of our budget this year, where last year at this time, we were 33.24. As you see, most of it is in part-time salaries and overtime salaries that was primarily related to COVID-related activities, clinics, vaccinations, whatever we needed. Our attachment number 6 is a comparison of last year to this year to give you a rough idea of where we stand. Again, you see the salaries were down about $222,000. Equipment, there really wasn't much there to talk about yet. Contractual or all our other expenses, it's pretty much even there. Employee benefits, again, when salaries are down, fringes are down. And again, our revenues are reflective of the fact that we don't have our our April billing in there yet. And also to note that revenues last year, referrals were higher than they are this year. So of course, our revenues were higher for our home care than they are now. But it's consistent with the salaries because of course, staffing is down, revenue is down, so they're all consistent, and we're trying to keep it about the same impact on the county. So those are the 2 financial reports I have.
All right, thank you. Any questions from the committee members regarding the financials? No, we're all set there. Okay, thank you, Dawn.
All right, so I'm going to go down to the meeting and conference authorizations. These are on attachments 10, 11, 12, and 13.
Okay.
The first one is we received approval to authorize Robin McLaughlin, our therapy supervisor, to attend a Home Care Association's 4-part webinar series, Reinventing Rehab under PDGM, which is the current reimbursement strategy for how therapy management provides 5-star providers. This is a webinar series that costs $260, and the funding is in the budget. The second authorization that we approved is for Beth Paquette and Jamie Martin, 2 of our WIC staff, to attend the Gold Lactation online training. This training costs $265 for each, totaling $530. The funding is in the budget and it's totally covered by the WIC grant, and those are attachments 11 and 12. The third authorization that we requested, or 4th, depending on how you look at things, this has been through a lot of excitement this month. We initially authorized or requested for Jody Brines to attend. Then the date got changed to the 25th. And now because of the date change, Jody can no longer attend because she'll be out on vacation. So we're looking to authorize Val Wisnot. On Friday, we did receive the signed authorization, which isn't in your packet, but we did get that authorization for the name change. I just wanted to bring that to your attention since it was a change in your agenda. Any questions on those?
Any committee members? No, I think we're good now.
Okay, thank you. So we don't have any referral for pending items, and with privilege of the floor, I do have one thing I want to bring up that's kind of a late breaker. We brought another potential resolution request up to be given out today, hoping that you all received it. It's to amend the budget, and I just thought I would explain. So we received our ELC grant, which is a school-related grant. It was $1.7 million. Back September, October, November, we worked on getting testing resources available for the schools. And you might remember the quadrant contract. Well, with this in mind, the state then started providing testing resources to the schools. So then that money really wasn't being utilized. So now the grant people at the state level are saying, work with your schools, find out what they need for supplies and equipment, and use that money to help them. Some of the schools are looking at buying a $2,500 unit that does air purification for each of the classrooms. That is an approved item. That's a sole source provider. I've sat in a couple webinars on that, to learn about that product. And New York State has approved that for the schools that want to do that. Some schools are asking us to replace or get them replacement filters for their current HVAC systems. I'm still waiting on the quotes for those. And then some other schools are working to put HVAC systems in place where it's around $9,000 a unit. With the money, if, I was to just kind of haphazardly divide it between the schools, it's around $100,000 per school that we can spend. Now, some schools don't want the funding. Some schools might go a little bit over that. Some might go a little under that. But for what the schools are asking right now, it's just magically working out for Warren County, which is nice. The problem becomes on purchasing and procurement. And with this $1.7 million grant, the funds that we've not utilized to date that we don't have allocated for staff or advertising, we're trying to put those into an equipment and supply line so that we're able to utilize that money so that when I'm able to get my budget modification approved by the state, saying that they'll approve those items that I need to purchase for the schools, that I will then be able to use that money to purchase that equipment. So what this, and I'll have Ton follow up if you have any questions. She's the numbers person, I'm not. But what I'm basically asking in this is for the committee to approve the resolution to accept putting the money in the right pots, and then to hold off on the board meeting approval until we get the state approval. And then we'll put it at whatever board meeting is after the state approval, if that makes sense. I'm just trying to expedite that process a little bit is what I'm trying to do.
Makes sense. All right, let's have someone bring a motion to the floor then. First, we have to vote on this, right? Supervisor Bramer, second by Supervisor Geraci. Now, if we have any questions for Janelle, now's the time. Yes, Mr. Moore.
Just a technical question, the department code under revenue, should that be 4194?
Oh, yes. Typo, thank you.
Supervisor McGowan.
Yes, thank you, Chairwoman. I've just been reviewing, we just went through school budgeting, and I, usually take some time and review the different school budgets over there. And I happen to notice that a lot of the school budgeting, there were upgrades to their HVAC systems, and air monitoring and stuff like that. So, I guess my question is why isn't the state going directly, dealing with the school? Why are they coming to the county? In these grants, and then what happens if we give the grants to the schools and they turn around and do they use that toward this, or do they upgrade the budget? I guess am I missing the whole thing here?
Yeah. So first of all, when the counties as a general were first told we were getting this grant and that it was a school related grant, and I think I even said it's an ELC school grant, all the county public health departments are like, we're in the middle of COVID. Why are you giving us the money for the schools? Give it to the schools directly, go through the BOCs. For whatever reason, they wanted it to go through the county health departments. I think all but one county accepted the money and then have been working with their schools. Every county, especially now in the game where they weren't able to spend all the testing resources, because, state started providing that. Every county is kind of doing things a little different. I talked with our treasurer's department because I heard that other counties were just saying to each school, here's how much money you have, you purchase the approved equipment, you let us know and we'll reimburse you. Our treasurer's department preferred that we purchase on behalf of our schools. So to answer your question, we're not really giving the grants to the schools. We're just offering to purchase some COVID related mitigation equipment and supplies on behalf of the schools. Last month, you might remember that we asked for contracts with all the schools so that we could give them the equipment. Now I'm looking to get the money in the right place so I can purchase the equipment.
Thank you, Janelle.
Yes, thank you for that explanation. Any other questions? All right, then let's vote on the resolution. All those in favor?
Aye.
Opposed? Carried. Thank you. Anything else, Janelle?
I don't know if anybody's interested in monkeypox. We've seen that there's been a few cases in the United States now, most of them related to travel. It's not really highly contagious person to person, just to let you know. The CDC did send out a health alert network, which we're forwarding to our providers, basically advising them to just be surveillancing for any rash and fever related illness that might be consistent with monkeypox, talking a little bit about the isolation protocols and the reporting protocols and the testing protocols to confirm the diagnosis. So we are also sending that out to our providers just to kind of make sure locally we're kind of in a ready position should we have anything present to our providers so that we're quickly able to work with them. I don't anticipate that we're going to have a lot of action here, but I just thought maybe there might be people concerned. But it's very low infectivity rate as far as person to person. You really have to have some direct contact for that. There's a small tidbit, it might be airborne. We're all wearing a mask, this, that, and whatever, but there's not tons of people walking around with monkeypox, but I just thought I would advise that we're putting our providers on alert.
Thank you, appreciate that. Anybody else on the committee have anything? No, if not, I will entertain a motion to adjourn. Supervisor Conover, second by Supervisor McDevitt. Any discussion? All those in favor? Aye. Thank you.